Hi, I'm Dr. Stewart Spitzer. I'm a general surgeon in a small town in North Texas. When I graduated medical school in 1993, there was a doctor-patient relationship. Each one provided something. The doctor provided care, the patient provided payment. And there was no doubt as to whose best interest that doctor served. You fast forward to today, and the patient doesn't, at least directly, pay anything. The insurance company and the government pay the physician. So who has the patient's best interest at heart? The bureaucracy of the federal government or the insurance company? Under the United States Constitution, the federal government has no right to hold me accountable for anybody's care. But that's the linchpin of ObamaCare, revolves around accountable care organizations and insurance mandates. The insurance mandates will fail because ObamaCare forces the insurance to provide coverage that people don't want or need. When these fail, and they will, people will be forced into the accountable care organizations set up under ObamaCare. These accountable care organizations are accountable to the government and not to the people. Hospitals are gearing up for these now. Currently, there are oceans of bureaucrats who are running through the hospitals looking for errors in compliance. And while quality sounds like a great idea, quality to a bureaucrat and quality to a physician and to a patient are two different things. To me, quality means the patient does well. To the patient, quality means the patient does well. To a bureaucrat, quality means that all the metrics were met and the paperwork was done and payment will be received. According to these bureaucrats, it doesn't matter as long as these guidelines are followed. The guidelines don't treat patients. Doctors and nurses treat patients. So if you want your doctor and your nurse to make your decision based on your care, then you must oppose these changes that are proposed under Obamacare. Another aspect of Obamacare which is hurting patients is the health information system technology. Physicians are forced to buy this equipment or face cuts in their pay. These systems were supposed to be for lowering cost as far as not duplicating tests, but their implementation has been expensive and there are also some large privacy concerns. Previously, at night, your records were stored under lock and key and were written in a physician's office. Today, they're all transmitted to the federal government, which is supposed to keep them private. If you think your personal data is safe with the federal government, then obviously you've not seen WikiLeaks. This has been depressing, but I believe in America and Americans. Our solution to this is to kill Obamacare and replace it with patients being in control of their own care. The insurance companies or the government could pay the patient directly. After all, it is your own money. High deductibles and health savings accounts are the ways to go. Let's say you do, unfortunately, obtain the diagnosis of a cancer. The insurance company could pay you $250,000, $300,000, or whatever your insurance pays. You could take that money, and I promise you, there will be cancer centers springing up all over the place that will take your money for less than that to treat your cancer. Not only that, but there'll be others that will spring up to compete against them. And that will raise the quality and lower the cost. As opposed to when government controls things, costs always go up and quality always goes down. All we need is the courage to stand and say, no thank you, Obama, but we'll take care of ourselves. There are other physicians just like me who feel this way, as well as some politicians such as Ted Cruz who are leading the fight to repeal Obamacare. With your help, we can do this. God bless you all. God bless America.